Hello folks, the topic of this video is the 12 months results of the Gather2 clinical trial. This channel, Eduardo B, is dedicated to provide educational content to eye care professionals like ophthalmologists, fellows and residents, or even medical students. I hope you've been enjoying the content of this channel. The 12-month result of the Gather2 trial have just been released. It was a phase 3 clinical trial with a new drug which is a complement 5 inhibitor for treatment of geographic atrophy related to dry age-related macular degeneration. The name of the drug is called avastin captad pegol. In this Gather2 trial, 448 patients were enrolled in a double-masked, sham-controlled clinical trial, multi-center and international. Patients were randomized into sham or intravitreal injections or 2 milligrams Zimura, which is the name of the drug. After the first year, patients will be re-randomized. So these results we're going to discuss today is just about the first year of the clinical trial. Before we move into further details of the study, let's remind you that this is still an investigational drug. Overactivity of complement system may induce progression of dry age-related macular degeneration, and complement 5 may have a key role in the worsening of the slow inflammation related to the atrophy of the macula. Therefore, Zimura can block C5 and maybe reduce the progression of the disease, and that was the rationale for the phase 1, 2, and now the phase 3 trial of the Zimura. Let's discuss the results of the clinical trial which have just been released. The drug induced approximately 15 to 20% reduction in the growth of the area of the geographic atrophy compared to sham. The company also performed a review of the patients enrolled in the United States clinical trial. That post-analysis revealed that the reduction in the area, the progression of the area of the geographic atrophy may be even greater, around 30% in patients treated with Zimura. I have the pleasure of being one of the principal investigators of this trial. The company is planning to submit a evaluation to the FDA soon, so the drug can be available to the patients in the United States and then worldwide very soon. What are my opinions about these results? I think they're pretty positive and impressive because geographic atrophy is a very slow process disease, and that the drug can induce 30% slower progression in such a short period of time of 1 year. That's a pretty good result. We need to keep in mind that geographic atrophy natural history may last 10 to 20 years. So in just 5 to 10% course of the disease, the drug was significantly effective. Those results are also impressive because they may prove that indeed for geographic atrophy, complement may have a major role and significant in the clinical practice. In summary, we are pretty excited that for the first time we may have a drug available to slow the progression of geographic atrophy. Let's keep in mind that geographic atrophy may affect about 10% of the patients of the total group of patients with age-related macular degeneration. The other 10% are macular neovascularization and about 80% are drusen. So we discuss here and present to you the initial results of the Gather2 trial. We're going to continue to discuss that pathogenesis, mechanism, and further treatments of dry age-related macular degeneration. I hope you liked this video. See you next time.